My name is Cydney McGuire, and I am an assistant professor at the O'Neill School of Public and Environmental Affairs at Indiana University. I will be sharing about our work focusing on policymaking and health equity that was published in Health Affairs. I would like to thank my colleague, Dr. Shekinah Fashaw-Walters, who invited me to work on this manuscript with her. Our paper is entitled, Proposing a Racism-Conscious Approach to Policymaking and Healthcare Practices. In this paper, we present a framework designed to help decision makers who are seeking to craft policies that improve health outcomes and eliminate health inequities. We focus on the concept of racism-conscious health policymaking. A racism-conscious health policy, or RCHP, is a policy designed with racism in mind, meaning that policymakers consider the various forms racism may take and use this information to inform policy design and implementation. Our framework outlines two foundational principles for policymakers to adhere. The first, engage and center the communities and voices of marginalized groups. And the second, conduct continuous and ongoing evidence evaluation and policy analysis. These foundational principles should be applied throughout the 5 steps, which guide the policymaker from identifying current inequities to elucidating the impact of racism and finally crafting a new racism-conscious health policy. Designing policies to account for racism is exceedingly important to achieving health equity and eliminating the structural barriers that give rise to and maintain the social, political, and economic limitations imposed on minoritized groups in America. In our manuscript, we walk through an example focusing on racialized inequities in access to high-quality home health for Medicare patients and consider how current policies can be revised to incentivize higher quality care for racially minoritized patients. This framework can also be expanded to apply to broader social policies beyond health to create socially conscious policies, and we speak to that briefly within the paper. We hope this framework can help policymakers at multiple levels craft racism-conscious health policies that can advance health equity in a politically feasible way.